Stop scrolling right now. If you're eating the wrong breakfast, you're sabotaging your blood sugar before your day even begins. And what I'm about to tell you could be the difference between struggling with diabetes medications for the rest of your life or finally getting your blood sugar under control naturally. Most people have absolutely no idea that what happens in the first hour after you wake up determines whether your blood sugar will be stable all day or whether you'll experience dangerous spikes that are slowly destroying your body. I know this sounds scary. I am Dr. Michael Kent. Let me tell you something. I've seen it happen too many times in my practice. People come to me desperate, taking multiple diabetes medications, checking their blood sugar 5 times a day, living in constant fear of complications. And when I ask them what they eat for breakfast, I hear the same devastating mistakes over and over again. Orange juice, white toast with jam, sugary cereal, instant oatmeal packets loaded with hidden sugar. They think they're eating a normal, healthy breakfast. Meanwhile, their blood sugar is skyrocketing before they even leave the house. But here's what nobody's telling you. The problem isn't just what you're eating for breakfast. The problem is that you're missing 5 critical morning habits that must happen before you even think about food. These 5 habits work together to prepare your body to handle blood sugar properly throughout the entire day. And the best part? They're completely free. They don't require expensive supplements or complicated meal prep, just simple changes that take less than 30 minutes total. Today, I'm going to reveal all 5 habits, explain exactly why they work, and then give you 3 perfect diabetes-friendly breakfast options you can start using tomorrow morning. By the end of this video, you'll understand how to take control of your blood sugar from the moment you open your eyes. Let me start by explaining something most doctors never tell you. While you're sleeping peacefully at night, your body releases a hormone called cortisol. This hormone serves a very important purpose. It's what wakes you up and gets you ready for the day ahead. But here's the problem. This natural cortisol release causes your blood sugar to rise even if you haven't eaten anything yet. This is why many diabetics wake up with high blood sugar readings even though they didn't eat anything overnight. It's called the dawn phenomenon, and it's completely normal. But what you do in that first hour after waking up determines whether that elevated blood sugar comes back down naturally or stays dangerously high all day long. That's why the habits you practice in the morning are absolutely critical, especially the 5 I'm about to teach you. These aren't complicated medical interventions. They're simple, practical habits that work with your body's natural rhythms to bring blood sugar down without any medication needed. Let's start with habit number 1, and I'm warning you right now, 90% of the people watching this video are not doing this simple thing. Habit number 1 is drinking water immediately after you wake up. Not coffee, not tea, not juice, pure water. Let me tell you about a patient of mine named Robert who came to my office completely frustrated. His morning blood sugar readings were consistently high and he couldn't figure out why. I asked Robert to walk me through his entire morning routine in detail. He told me he wakes up at 5 in the morning, drinks his coffee with milk, eats whole wheat toast like I had recommended, has some boiled eggs mid-morning, and so on throughout his day. Then I asked him a very specific question. I said, Robert, if you had to tell me what time you drank your first large glass of plain water yesterday, what time would that be? Do you know what Robert told me? He didn't drink water until 3 o'clock in the afternoon. Think about that for a moment. All night long without water, all morning without water, past lunchtime without water. Here's what you need to understand. While you're sleeping at night, your body continues working constantly. Your kidneys are filtering waste. Your heart is pumping blood, you're sweating, you're breathing. All of these processes use water, so we wake up significantly more dehydrated than when we went to bed. And when you're dehydrated, your blood becomes more concentrated, which means your blood sugar readings appear higher than they actually need to be. If you don't replenish fluids immediately after waking up, that concentrated blood sugar stays elevated much longer than necessary. This is why it's absolutely critical that the moment you wake up, right after you brush your teeth and before you do anything else, you drink 2 large glasses of water, or 1 very large glass, at least 16 ounces. Now, I want to know how many people watching this video right now are actually doing this habit consistently. Be honest with yourself. Starting tomorrow morning, You're going to wake up and drink 2 full glasses of water before doing anything else. You can enhance this even further by adding a squeeze of fresh lemon to the water. And if you want to lower your blood sugar even more effectively, add a cinnamon stick to your water bottle the night before and let it infuse overnight. When you wake up, you drink from that bottle. Remember, cinnamon has been scientifically proven to help lower blood sugar levels, so it's an excellent complement to the water you're already drinking. Habit number 2 is moving your body immediately after you wake up. If you get up and do some form of exercise, like going for a 10 to 15-minute walk outside, or even just placing a chair against the wall and doing squats for 3 to 5 minutes, you can cause the elevated blood sugar that's circulating in your bloodstream to be absorbed and used by your muscles. You don't need to do intense heavy exercise the moment you wake up or go for a long run, although those would certainly be beneficial if you have the time. The key is to move for at least 10 to 15 minutes. What this movement does is act like a key that unlocks your cells, allowing blood sugar to enter the cells where it's needed for energy instead of staying in your bloodstream where it causes damage. Gentle yoga or Pilates done on an empty stomach are also excellent strategies for improving blood sugar control. Remember that cortisol gets released to wake us up, and cortisol causes blood sugar to increase somewhat. So by moving your body early, you're telling your muscles to absorb that excess sugar. This simple habit can prevent dangerous blood sugar spikes before they even happen. Habit number 3 is consuming a breakfast that's high in protein and high in fiber. And I'm going to bust some major myths right here, so pay close attention. If you wake up and drink orange juice, eat white bread with jam, your blood sugar will spike dramatically and rapidly. You'll create a huge glucose spike that damages your blood vessels. This is why it's extremely important that you prioritize protein and fiber at breakfast. Foods like plain, unsweetened yogurt, 2 or 3 eggs, tofu, cheese, and other protein-rich foods that I'll describe in just a moment will help keep your blood sugar stable from early morning. They'll also keep you feeling full and satisfied for much longer, which means you won't get hungry as quickly. And when you're not hungry, you make better food choices throughout the rest of the day. Now, many people ask me about fruit. Patients with diabetes and even healthy patients ask me, can I eat fruit in the morning? Of course you can. The important thing is to eat whole fruit with the skin and the pulp intact. This matters because fruit contains fructose, which is the natural sugar found in fruit. But the fiber in the pulp and skin essentially encapsulates that sugar and slows down its absorption. So if you eat whole fruit, you won't generate blood sugar spikes. As long as you eat 1 fruit, of course. If you eat 10 fruits, even if you have diabetes, yes, you'll probably spike your blood sugar. That's common sense. So it's very important that you understand you can absolutely eat fruit in the morning. The ideal choices are low glycemic index fruits like pears, apples, berries such as strawberries or blueberries, and peaches. Now, some patients want to eat bananas because it's a fruit they enjoy. Yes, you can eat bananas too, but choose them when they're still quite green because the greener the banana, the less sugar it contains and the more resistant starch and fiber it has. And if you have diabetes that's not yet well controlled, choose half a banana instead of a whole one and save the other half for an evening snack. As I mentioned, try to avoid fruit juices completely because those are pure sugar. When you juice fruit, you're discarding the fiber, which is your protection against blood sugar spikes. Another thing people ask me about frequently is oatmeal at breakfast. If you have diabetes, if you're trying to lose weight, or if you simply want to eat healthier, oatmeal is an excellent option. Always choose the most whole, least processed oatmeal you can find, like steel-cut oats or old-fashioned rolled oats, because these contain much more fiber and don't generate blood sugar spikes. What you need to avoid is instant oatmeal packets because those have been so heavily processed that they have a much higher glycemic index and can cause blood sugar spikes. So, fruit at breakfast? Absolutely yes. Oatmeal at breakfast? Absolutely yes. Let me give you 3 quick breakfast options you can start using immediately. Option number 1 is whole grain toast. And if you froze the bread first and then toasted it, that's even better because freezing and reheating bread creates resistant starch, which lowers its glycemic impact. Top it with a slice of cheese, add tomato and avocado if you'd like. This combination gives you plenty of protein and fiber. And if you want to stay even more satisfied, add 2 scrambled eggs on the side. The second recommended breakfast is plain yogurt with no added sugar or artificial sweeteners. Choose the yogurt with the highest protein content you can find. It doesn't need to be low-fat or fat-free. Regular full-fat yogurt works perfectly fine. Add a small handful of nuts like almonds or walnuts and some fruit. It could be pear, berries, or finely chopped green banana. The third option I'll give you is a smoothie that you can make with plant-based milk or regular cow's milk. Add 1 tablespoon of natural unsweetened peanut butter or almond butter because nut butters contain lots of protein and healthy fats. You can also add some chopped fruit, blend it all together, and drink it before leaving your house. Tell me if you liked these breakfast ideas, and I want to hear what you eat for breakfast every single day so we can discuss it together in the comments. Habit number 4 is exposing yourself to natural sunlight as soon as you wake up. Something as simple as opening your curtains wide or spending just a few minutes outside in the morning sun can determine how your body manages blood sugar throughout the entire day. Natural light regulates your internal biological clock, your circadian rhythm. It helps cortisol follow its normal pattern, which is rising in the morning to wake you up and then gradually declining throughout the day. This prevents cortisol from staying elevated all day long, which would keep your blood sugar dangerously high. Scientific studies demonstrate that 20 minutes of sun exposure in the morning, obviously during safe hours before 10 a.m. or after 4 p.m., is associated with better metabolic control and lower risk of developing type 2 diabetes. The beautiful thing is that all these habits I'm teaching you can be combined together seamlessly. For example, you can wake up, go outside for a 10-minute walk, and you're already moving your body while exposing yourself to sunlight. Take your water bottle with you, drink 16 ounces of water, and you've already accomplished 3 habits. Then you come home and prepare a healthy breakfast, or you bring a prepared breakfast to work that you made the night before. And habit number 5 is reducing stress before you start your day. Stress triggers cortisol release, and elevated cortisol causes your liver to release stored glucose into your bloodstream, raising your blood sugar. For many people, the first stress spike of the day happens the moment they wake up and immediately check their phone. Pending work tasks that create anxiety, difficult news, stressful messages, all of this makes us stressed and causes blood sugar to spike right after waking. The simple act of doing deep breathing exercises for just 2 minutes can change your blood sugar levels when you wake up. Let me teach you a very simple breathing exercise. You're going to inhale air through your nose for 4 seconds. Once you've inhaled completely, you're going to hold that breath for 2 seconds. Then you're going to exhale slowly through your mouth for 6 seconds. So it's inhale for 4, hold for 2, exhale for 6. This exercise lowers your heart rate and helps your nervous system shift from a state of alert and stress to a state of rest and digest, which improves insulin function. This makes your insulin work more effectively. This is why so many patients tell me, "Doctor, when I get stressed or nervous, my blood sugar goes up." This is absolutely real. It's caused by exactly what I've been explaining about stress hormones. This is why breathing exercises are so important at multiple times throughout the day. You don't have to only do this in the morning. If you feel stressed during the afternoon or you got upset about something, do this breathing exercise. Inhale for 4, hold for 2, exhale for 6. Practice it right now as you're watching this video. And now I'm going to give you a bonus tip that wasn't in my original script, but I'm going to share it with you anyway because it's that powerful. Drink a glass of water with apple cider vinegar before going to bed at night. This can help keep your blood sugar much more stable overnight, and when you wake up in the morning, the acetic acid contained in vinegar, especially apple cider vinegar, which is the most researched, slows down gastric emptying, which means sugar enters your bloodstream more slowly. It also improves insulin sensitivity, which is crucial for diabetics. However, never drink vinegar straight. Either mix 2 teaspoons of vinegar diluted in a large glass of water or add it to your meals. Never consume it undiluted. And if you suffer from acid reflux, stomach ulcers, or active gastritis symptoms, do not use vinegar and consult with your doctor first. Notice how small habits can make an enormous difference. In this video, I've explained exactly why each habit works. Many patients come to my office terrified that I'm going to give them an expensive diet they can't afford or a diet they can't maintain long term. But notice that throughout this entire video, I never once talked about a restrictive diet. I talked about simple, sustainable habits: drinking 2 glasses of water when you wake up, moving your body for at least 10 minutes, doing breathing exercises, eating a properly balanced breakfast with protein and fiber, managing your stress. These are habits anyone can do regardless of income or lifestyle. Now, I want to know from you, of these 5 habits I taught you, which ones are you already doing consistently, and which ones would you like to start implementing starting today? Leave your answers in the comments below because I read every single one and I want to help you personally. And here's my challenge to you. Pick just one of these 5 habits and commit to doing it every single morning for the next 7 days. Just one. Don't try to do all 5 perfectly right away. Start with the one that feels easiest for you. Maybe it's the water, maybe it's the 10-minute walk, maybe it's the breathing exercise. Do that one habit consistently for 7 days and track your morning blood sugar readings. I guarantee you'll see improvement. Then once that habit becomes automatic, add the second habit, then the third. Within a month, you'll have transformed your entire morning routine and your blood sugar control along with it. Remember, diabetes is not a life sentence of suffering and medication. Your body wants to heal. Your body wants to regulate blood sugar properly. You just have to give it the right tools and the right environment. These 5 morning habits are those tools. They cost nothing. They take less than 30 minutes total, and they work with your body's natural rhythms instead of against them. I'm Dr. Michael Kent, and I want to see you healthy, energetic, and free from the constant worry about blood sugar. Start tomorrow morning. Set your alarm 15 minutes earlier. Drink your water. Move your body. Breathe deeply. Eat a protein and fiber-rich breakfast. Get some sunlight. Do these 5 things and watch what happens to your blood sugar over the next 2 weeks. You're going to be amazed at the difference. Your body is more powerful than you realize. Give it what it needs and it will heal. Thanks for watching, and I'll see you in the next video where we'll discuss the 3 worst foods that are secretly spiking your blood sugar and exactly what to replace them with.